As Paul mentioned, I'm Dr. Corey Gonzales, and I'm here today to try to give a little bit of education about what we're trying to do in the mental health aspects of animal hoarding. And I want to start up by saying thank you for all you and what you do, because having been out on some of these shoots, it's not only compelling, but it's heartbreaking, some of the things that we are exposed to when we go into these situations. As Paul's mentioned, I'm a clinical psychologist by trade. I've been a psychologist for about 20 years. Also, I was a collegiate baseball player, and I mentioned this because I didn't get a chance to play my senior year due to getting a diagnosis of cancer. And I've been through 2 bouts of cancer. The first time was stage 4. I went from a 185-pound athlete to a 115-pound bald, fighting for my life person at age 23. So I'm familiar with trauma. And trauma is a very relevant issue as we talk about animal hoarding. And that's why I mentioned that. I also worked with the LA County Sheriff's Department for 3 years, involved with cops and helping them to deal with some of the trauma they were being exposed to. Also involved shooting and debriefings, hostage negotiating, general stress management, and support for law enforcement. Currently, I'm also, along with my private practice in Bakersfield, California, I'm also the director of behavioral health for a telemedicine company called Telehealth Docs. And this is relevant because we are delivering healthcare to rural areas. And for all you that deal with animal hoarding situations, you do know that rural areas is a key component and very relevant in this area. Paul mentioned I've done some media work. I do some radio, and I'm the local spokesperson for our NBC affiliate. But doing the 22 shows of Confessions Animal Hoarding was one of the most meaningful things I've ever done. And I'd just like to get a hand for those. Has anybody seen the show on Animal Planet called Confessions Animal Hoarding? Okay, maybe about half of you have. Okay, good. Well, we stopped shooting a few years back. We did 4 seasons. And the reason why we did this show is because the people at the Animal Planet had seen what's been going on with animal hoarding. And the way we traditionally have treated this problem is just through the criminal justice system. And what we found out, and as most people will attest to in this field, is that it's not a long-term solution. It's not working. Does anybody know what the recidivism is for animal hoarding after they get arrested?
100%.
100%, yeah, it's ridiculous. So we're not, there's some short-term help for these animals, but in the long term, we're not helping them. And you think about it for a second, how much our animals do for us. You think about, the animals, what the joy, the love they bring, the companionship to our families, our loved ones. Think of the service that the animals do for us in the military, in law enforcement, with our handicap, with our vets, with our blind. It's amazing what these animals do for us and how they serve us. And the one thing that I want to stress to you today, if nothing else, is we need to give them a voice. What we do know is that the DSM-5 does not consider animal hoarding a diagnosis. The DSM-5, we were hoping, and this is what the Animal Planet's real purpose was, is to try to get this acknowledged in DSM-5, because with that acknowledgement comes a lot of funds, a lot of grants, a lot of resources that will help our animals. The animals need a voice. They also, we just found out that DSM-5 just came out about a year and a half ago. They did include OCD hoarding type. And it's the first time. And guess why they did that? Anyone want to guess?
Because of the hoarding.
Because of the hoarding shows. All the publicity, all the education about the hoarding shows got it in, which is a good thing. However, we all know that in those situations, there's some similarities, but there's also some differences. And so that's why we need to really keep this movement going forward to give the animals a voice. It's tough. When you walk in these situations, we're going to have strong feelings about them. When we walk into a situation and we see a defenseless, dependent animal that's not getting the standard of care, that's not being fed, that's dehydrated, that's starving, there's toxoplasmosis, there's infections, and there's death. And these animals cannot defend for themselves. So, of course, you folks here in the audience say are all helpers and healers and community activists, and you serve your community. So it's going to be difficult when we see situations where people with a privilege of power exploit that, and a defenseless, dependent animal suffers because of that. It's going to make us angry. It's going to make us examine things about life. It's going to make us look at these folks in a certain way, and we're all going to want justice. And I just want you to remember that our criminal justice system is not doing justice to our animals. It's taking these people out of the situation momentarily, but with the recidivism being so high, the animals are eventually going to be caught up in this trap again. So we have to look at the core issues of this. And if you've ever seen, for those folks in here that have seen the show, in the beginning, you see that the line that says, you know, historically, animal hoarders have been treated as criminals in the criminal justice system until now. And ... until now. Now that we're going to unlock and we're going to look at these issues to see if we can do some real work and get some real resolution to this problem by getting to the heart and the mental health issues of these animal hoarders. One of the biggest breakthroughs for us came in 2009. Some research was done by Dr. Gary Petronik. Is anybody familiar with Dr. Petronik's work? Good. Good. It's good to see that. He is the gold standard. The Animal Hoarding Consortium and his work at Purdue, he released a monumental article in the Clinical Psychology Review in 2009 called A Theoretical Perspective to Inform Assessment and Treatment Strategies for Animal Hoarders. And when I was asked to go on this show, in Bakersfield, it's a pretty rural area, and I had some experience in doing this type of work because of that. And how I got linked up to this show is that I do the NBC affiliate show there in Bakersfield, and we did a show on animal hoarding. We did a little segment on it. And apparently some of the people that were involved in the show got light of that and saw that and contacted me, and I was so grateful for that. Dan, there was a few executive producers involved. Dan Jackson's one of them, and just felt a strong kinship with these animals. And Dr. Gary Petronik was a huge part of this show. When I decided that I was going to come on and I signed up with him, I reviewed all of Dr. Petronik's work and talked to him on the phone, and he came through with some incredible things. First of all, how can we treat something we don't know what it is or doesn't even have a definition or a disorder? And Dr. Petronik defined this. And his definition was, an animal hoarder is someone who fails to maintain the minimal standard of care for their animals. They are in denial and lack insight to this failed standard of care on their part. They also have an obsessive need to maintain or increase their number of animals. Now you think about that, the minimal standard of care they're not meeting. Ventilation, medical, social, food, all those things were not being met by these folks. He also found that from the year, and this is fascinating, from the year 2000 to the year 2006, we had a 5-time increase in the number of animal hoarding cases that were reported. And I think that's fascinating. You think about what happened to our country in 2001, why this thing began to really run its course, and all the pain, all the suffering, all the dysfunction that's gone on. And I think that was fascinating. He also found that a third of all of our compulsive hoarding cases involve animals. There are similarities between object hoarding and animal hoarding. I think we all know that. Some of the similarities that we see is that both the object hoarder and the animal hoarder have an excessive attachment. And this excessive attachment decreases their anxiety. It gives them a false sense of security. It's almost like, when you hear about OCD, the person that needs to check locks. What do you think checking locks does for their anxiety? It reduces it. That brain is obsessively going on with anxiety, and the only way they can reduce it is to check. The problem is that pretty soon checking once isn't doing it for them. They build a tolerance, they need to check twice. Pretty soon checking twice isn't doing it for them. They've got to check 3 times, 4 times. Pretty soon you're finding this person's impaired. It's interfering with their life. We also see the same thing with animal hoarders. They build up tolerance and they have withdrawals. And if anyone has watched the show, what do you see when they have to hand over those animals?
Anxiety.
Anxiety. Anxiety. And where does this anxiety stem from? This anxiety, Dr. Petronik identified areas that are really important for us to understand. This anxiety, a lot of times, stems from trauma. That when somebody in their formative years is traumatized, and I'm not saying everyone that goes through trauma ends up getting PTSD, by the way. What we do know is about 15 to 20% get it. But of the people that have PTSD, they've all been through trauma. And when you've been traumatized in your formative years, particularly those years where all our hardwiring is being done, the first 10 years of your life, your personality structure is pretty much completed. If you've had trauma during that time, it can affect the wiring of the brain. And that whole fight or flight response gets busted. In other words, that fight or flight is going off too much. And we've seen this a lot with our veterans as well. When we go overseas, we go in combat, and we have to fight, and we are exposed to trauma, we come back, and it's hard to shut off that fight or flight response. We have excessive anxiety. So we're trying to shut it off by substance abuse or, any way we can. We're not going out in crowds. We have avoidant issues. We don't want to have those symptoms. So trauma causes anxiety. The other thing we saw is that a lot of these folks had OCD, which is no surprise to a lot of you. So post-traumatic stress disorder, obsessive compulsive disorder. And by the way, folks, when you hear OCD, understand there's different levels of this stuff. And as you know, there's different spectrums with these animal hoarders as well. But with OCD, Axis 1, as we have in our diagnostic manual, there's impairment. And these people can't pull the trigger. I have a guy that I've been seeing for a couple of years now that can't even change lanes. He's got to not check once, twice, pretty soon 10, 11 times, and it impairs his abilities. Constantly thinking he ran over something, his brain is in danger. He has difficulty pulling the trigger. He cannot marry because he can't take risk because of his excessive anxiety. So that is debilitating. That's a high level of anxiety. We also have something called obsessive compulsive personality disorder. And that is somebody that's not quite as impaired. In fact, if I have a business, I won't mind having people with OCPD, obsessive compulsive personality disorder, working for me, because these folks do it by the book. Their attention to detail is incredible. They have a strong work ethic, strong values. Sometimes they're a little difficult. They may not want to hang out on the weekend because they may tend to be inflexible or lose perspective or may not be real balanced. But for the most part, they're really good folks and they do good work. So don't confuse OCD, obsessive compulsive disorder, with obsessive compulsive personality disorder. Two different beasts there. So we found out that there's a lot of psychopathology, and animal hoarding is not a disorder yet. So the way we're looking at it is animal hoarding is a manifestation of other problems. And I've talked to a few folks last night that do some of this work, and we're all in agreement that animal hoarding is fulfilling some kind of unmet psychological need for these hoarders. It is fulfilling some kind of psychological need. And also, although it serves a function in their mental health, it's a dysfunctional behavior. And these people's mental health is really deficited. And those that have worked with them, and I talked to a couple guys last night, we were just like, after the whole thing went down, I'm sitting there staring at this guy and I'm thinking, wow, this guy's got a lot of psychopathology. This guy's got a lot of issues. I wasn't sure what to do with him. They need mental health treatment. So when you hear therapists say, what is a disorder or how to treat it, you now know there's anxiety-based issues. There's trauma, there's OCD. And one of the things that Dr. Petronik also pointed out, which just really nailed it on the head, and I hope it does get more acknowledgement. And I don't know if anyone's heard this term, primary attachment dysfunction. Primary attachment dysfunction. What a term. These folks have had some kind of dysfunctional thing that happened to them in their primary years with their attachment figures that's messed them up. They've either been abandoned, neglected, abused, something has happened. And many times, animals have fulfilled a role for them as well when they were in a dysfunctional family. If there's an alcoholic, or if there's a domestic violence, or there's more psychopathology in the family, many times these people were comforted by their animals. So sometimes the animal hoarders, one of the needs that they get met is the identity of a rescuer. They actually believe many times that they're rescuing these animals. And you guys have been to and sometimes they actually do, but most of the times they don't. And one of the great questions that you can ask an animal hoarder when you see them is ask them to explain the difference between rescuing and hoarding. Just ask them to fill in the blank. And most of the times they'll recognize, because they have a real lack of insight, but this question is really an important question. Just define the differences, and they'll make them think a bit. So primary attachment dysfunction. These animals are fulfilling a need for their attachment needs. They have a need because of something that's happened, this primary attachment dysfunction, to be in a position in a relationship where they're a person and you have an animal down here. They're comfortable in that. They want control. They don't want to have a peer relationship like this. They want to have that. They tell themselves, I never want to feel that way again. And in this relationship, I'm in control. The other thing that they get oftentimes from these relationships is something that we all deserve as a child, but is inappropriate to ask for as an adult. Does anybody know what that would be, that need?
Unconditional acceptance.
Unconditional love. Excellent. It's appropriate for a child to want unconditional love. But what happens if you don't get it? We have to accept that. We have to accept what we can and can't get from our folks, our parents, our family dynamics, all those things, and not continue to try to get that in other avenues. I've been married 23 years. I know if I was overly aggressive or physically abusive, I would expect that my wife would leave me. I would expect that she would tolerate that and that I would get unconditional love if I behaved like that. These animal hoarders are looking for unconditional love as well. So primary attachment dysfunction, personality disorders, which we see quite a bit, post-traumatic stress disorder, obsessive compulsive disorder. The animals are meeting some unmet psychological need. They serve a function for these animal hoarders' dysfunctional mental health. One of the things that we also found in our 22 shoots, and Dr. Pertonic pointed this out well, is that the animals buffered against a lot of unresolved grief or unresolved loss. That the hoarder uses these animals to not have to deal with certain things that they've been through. It gives them, again, the identity issue. I mean, one of the things we see different in the object hoarders versus animal hoarders, this issue about identity, I'm a rescuer. And some of these folks get this idea that they're actually rescuing, and they have this hypervigilance about mistreated and abused animals. And they think that they're the only ones, they're special, that can really rescue these animals. And this emotion is so profound that it supersedes that part of the brain that's rational. Most theorists will tell you we have two sides of our brain. We have a feeling side and we have a thinking side. Those feelings are so profound for animal hoarders that it supersedes their rational mind on what they can really care for. It distorts it. So you can see delusional stuff going on. These people need treatment. Therapy, medication oftentimes is indicated as well. As I mentioned earlier, if we look at the addiction model, we see that this is a lot like addiction in that they build up tolerance and can have withdrawals, and it impairs their functioning. Most of the folks on this show, first of all, I was asked a question earlier about, hey, how'd you get subjects? How'd you do the casting on the show? we had a website, and we oftentimes had people get on the website that had family members or friends that were out of control. And there are a lot of people that start off in this behavior that actually are well-intended. The problem is that things get out of control and can get delusional and get bad real quick. And one of the things the show provided for folks, and this is very different from the real world, I understand that. And I know in Kern County that, there's just way too much euthanasia. We are putting down way too many animals. We don't have enough no-kill shelters. So the neat thing about the show is we had the Humane Society following us around the country in a mobile veterinary trailer, really impressive actually, unit, and treated animals. Treated the animals, it was no-kill policy. We also went in there, cleaned up their houses. We also provided therapy for them after we left. It was all mandated that, and we also did psychological screenings on the candidates. We didn't want to exploit people, someone that was not a good candidate. In fact, I think the people at the Animal Planet did a pretty good job of editing, because there were some situations we went to that was really bad. And I was surprised when I saw the finished business about how, one of the stories, it actually was in Houston. They cut out a whole character. I thought it was going to be on this one female, but she was so out there. Intoxicated, overly provocative. She really made herself look silly that they just cut her out of the whole story and they just focused on her mom, which I was shocked that they burned so much tape they're able to do that. There are situations where there was a shoot in Oregon where during the family session that found out there was a lot of trauma, dealing with probably one of the strongest men I've ever met in my life, and you'll see him in a little bit, named Mike. And during the family session, found out there was an enormous amount of abuse to him as a child by his babysitter, and choked me up. I mean, this guy not only was abused as a child, he ended up having a substance abuse problems, had a drunk driving, killed somebody, went to prison, and actually got into some situations in prison that were really bad, and learned to dissociate from bad stuff. He learned to block things out like nobody I've ever seen. We were literally sliding in cat feces around his home because he just didn't see it. He learned to dissociate like nobody I've ever seen. You'll see his story in a minute. The neat thing about that shoot is we got that whole house cleaned up. We got his wife back in, his marriage back together, and we really saved his life. Many people in this situation, a lot like addiction. You guys have seen folks on meth or alcoholism or drugs where they want to get caught. They want to get caught. They're so out of control. They need help. Many people on this shoot needed help, and they knew we were legit out. You folks, the law enforcement, animal control was on their back, breathing on them. They knew it. Their relationships, their homes were destructed. Their finances were horrendous. Everybody had left them. So a lot of these people did want help, and we were legitimate help. So we did a psych screen on them. We made sure, looked at the casting videos. I went out as the on-screen guy, and I always told them wherever I went, listen, this is I'm going to try to help you. We're going to try to bring in some help, but we're going to have follow-up help. I wasn't their psychologist. We brought in psychologists afterwards to help them. They were local because I'm not local. I don't have a license in every state. So we had the local people set them up with therapy to try to really help the problem. And what we found out, folks, about 50% recidivism after our show. We did post-production follow-up. And we were so happy to see that. When you go from 100% to 50%, we're making a difference. And the way we're really going to make a difference is to get this acknowledged as a real disorder. When we get this acknowledged as a real disorder, just like they did with there's OCD hoarding type now in the Diagnostic Systematic Manual of Mental Disorders, the DSM-5. We need to get animal hoarding in the DSM-5. Once we do that, we're going to give the animals a voice. And that's the whole main objective here, is to give the animals a voice. They have none. And they do so much for us. We got to do it back for them. I'm going to go on to our reel. And the reel is going to be on some of these shows. If you haven't seen the show, you're going to get a chance to see some of the reels here. And I'm going to talk, as we go through each case, I'm going to talk a little bit about some of these topics on each case so you can get familiar with what this looks like. You know, what needs getting met here? Is there, you know, is there OCD going on? Is there post-traumatic stress? Is there, you know, identity issues? Is there attachment dysfunction? What's going on here? So I'm going to take us through, and then after that, we'll open up for some questions, okay? So let's go ahead and start the projector, Paul, and get that started. Also, if we get some lighting change here, too, that'd be